This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.
Another really common question that's asked by our patients is, what actually causes my back pain?
So essentially, it's where the sites of ligaments and tendons attached to bone, these areas become inflamed, and that's a term that we would call enthesitis. And then the repeated inflammation can lead to further bone formation, so more bone can develop, which is part of the stiffness that the listeners will experience. And this will particularly affect the sacroiliac joints and the vertebra of the spine. And this could also, so patients can experience stiffness and also a reduction in their flexibility.
So Sean, is there a difference between this type of back pain that you get in axial spondyloarthritis and back pain you get with a disc prolapse or what we call mechanical pain?
Yeah, there are quite a few distinct differences in that with the patients with inflammatory back pain, which is obviously what we're dealing with axial spondyloarthritis, patients will experience stiffness. They will experience, and that's particularly first thing in the morning, and it's a pain and stiffness that will improve upon activity, but increase if they're resting. Whereas this is often the opposite with patients with mechanical pain.